Hey everyone, it's Dr. S here at Lux Surgery in New York City, and I have a really exciting announcement for you. Just a few days ago, the world's first long-acting peptide-based neuromodulator, aka Botox, aka neurotoxin, aka Dysport or Xeomin or Jeuveau, but basically a new neuromodulator called DAXXIFY got FDA approved. It's a pretty exciting new change and new paradigm shift as it continues to evolve in the world of aesthetics. It's made by a company called Revance. So it's pretty cool because, as I mentioned, it's a peptide-based neuromodulator. You may be wondering, what does that even mean? It's really in the processing and preservation of the toxin to be able to help improve the appearance of the glabella. Now, this isn't permanent, it's still a temporary acting type of neuromodulator, but it could last up to 6 to even 9 months in some individuals, which means that you may not have to get treated as frequently. It does behave though in a similar capacity, and we're still using all of our other amazing FDA approved neuromodulators in our practice, including of course Botox Cosmetic and Jeuveau and Dysport and of course Xeomin, but just want to let you guys know that this is pretty neat as we continue to evolve in the world of aesthetics. With that said, there's a few things that are kind of interesting, at least in the state of New York. So you may be saying, well, who can inject DAXXIFY in New York? Well, really, it's basically any licensed medical professional. There's a licensed physician, like surgeons like myself, as a plastic surgeon, of course, my dermatologic colleagues or any of my MD or DO type clinicians can, nurse practitioners, PAs, and of course, registered nurses also can inject neuromodulators in this state. But look at a state-by-state guidelines to see who can actually treat you with this product. It's going to be available in our clinics pretty soon. We're excited to be amongst some of the first individuals in the world to have it. And it's going to be really exciting to be able to take care of our patients and broaden our scope as we continue to treat patients. There's always some controversies with everything. So some individuals are saying, well, if we just inject more of our current toxins, we can get the same duration. Some of that may be true, but it'll be interesting to see how this one behaves in specific muscle groups. Now, although FDA approved for the glabella, we can also treat other areas off-label, which would be what we're already treating with our forehead and crow's feet, masseters, platysma. So looking forward to be able to incorporating this into our practice as we're trying to be out in front of new technologies and new treatments that we can offer our patients. In general, the way that the product works is you get injected. So if you've had Botox treatments before, you already know what we're talking about. If you haven't, you come into the clinic, we do an assessment, a full face plan is created for you, and we can do tiny little injections in a matter of a few seconds to minutes in these targeted muscle groups. Now, one of the things will be really important is it's good to have an expert injector take care of you, because you can imagine if you have a long duration and you're not happy with the outcome, you might be stuck with it for a little bit longer. So it's not just like you walk into any place and say, hey, DAXXIFY me or give me that treatment. We ultimately want to make sure that we're in the hands of expert injectors anytime you're getting a medical treatment. Some people are asking about frequently asked questions for us. How much does it cost? We haven't had pricing released yet. Be curious to see where this comes into the practice as a price point because of a longer duration. I would expect that it's probably going to be more than traditional neuromodulators, but you'll also be coming in less frequently for it, so that might be of interest to some of our patients in general.